Yes, good morning. Are we on now?
Yes.
Okay, awesome. Okay, good morning, everyone, tribal leaders and everyone else on the call. This is an update from the Northwest Portland Area Indian Health Board. My name is Laura Platero and I'm the Executive Director of the Health Board. And so just wanted to share that the board has been very active in responding to all of the inquiries, requests, support, technical assistance from tribes in our area. We have set up a webpage with information and which constantly is being updated. We are having our tribal only call at 10 a.m. this morning, and the login information is on our website if you'd like to hear more from our tribes. We do get a lot of the tribal health directors on that call, so if you were interested in participating in that call, we welcome you to join that call. We also are hosting, just to share a little bit more information about what we're doing, we are having a clinic call on Mondays at noon for basically tribal health providers who would like to know more about COVID-19. It's a very clinical webinar that's every Monday, and so that's something we've been we've had 2 so far, and we will continue to do those on Monday. They are available. They are recorded, so they are available, so you can watch them after. We also want to let you all know that there is a model tribal isolation and quarantine plan webinar being hosted by the American Indian Health Commission on Wednesday at 9 a.m. and they have been doing a wonderful job of getting information out to tribes as well. We did, and just to share some of the other sort of policy positions and things that we've been doing, one big thing that we just did last Friday was on Fridays, our executive committee passed a resolution basically declaring a public health emergency since we are the public health authority for the tribes in our area. And we also made strong recommendations for tribes to basically mitigate the spread of the virus by taking, of course, only having non-essential services go forward, but also we have been asking for tribes to put stay-at-home orders. We believe that this is the only way we're going to keep the virus from spreading. We are anticipating this to last a while. Our resolution does say that we're going to plan for up to 18 months in terms of just thinking ahead and trying to sort of plan for our organization and the tribes we work for. And we are also supporting any tribe who might need some technical assistance in this area if they would like to move forward in any type of order for their community. Our chairman also has been active and sent out a letter yesterday to our tribes letting them know, or letting you all know what LEMI is doing, and then in terms of they've done also a shelter in place as has McCaw, and other tribes I think are also jumping on board with that and just to keep their communities safe. So we have been very active with all of you, and we are tracking EPI numbers for the tribes in our area. We're in the process of collecting that information. Some tribes have been more vocal about the cases in their communities, while other tribes haven't. Of course, that's confidential information, and we always, of course, honor that. That is what we do. So at some point soon, we'll be able to share some numbers as we continue to collect information from our tribes in terms of what is going on and how it's impacting our specific communities. Does anyone have any questions for me?
Laura, can you give us current numbers in our region? Sure.
So in our region, we have in Idaho, there are 50 cases. In Oregon, there's 191 with 5 deaths. And in Washington, there's 2,221 cases with 110 deaths.
And we understand a few of those in Washington are from some of our communities, correct?
That's correct, Terry.
Okay. Does anyone have questions for Laura?
Can you hear me?
Yes.
You can't hear me. Oh,
Yes.
miracle. What a miracle. I don't know how much you've been following I know you've been following the congressional activity, but I know that there's been some funding set aside for for IHS, and I read where I may have missed this because I'm having problems here, but that they're going to give up the rules of distribution later this week. Have you heard any more about that?
No, they just basically, I know for the 64 million, I think the plan is to get those out via compacts and contracts, but I haven't heard any more detail on that. In terms of the other funding, the 80 million, we still are waiting for detail. That has been really long delayed. 40 million is supposed to go to tribes, tribal organizations, and urban Indian programs, and we're still waiting for the detail on how that will get distributed. There was also 30 million that is basically will go through tribal epicenters. It said through the CDC umbrella grants that tribal epicenters have, but we still haven't received more information on how that will work either.
Laura?
Yes.
This is Victoria. I just wanted to update you that request for proposal for the epicenter funds just was released about 5 minutes ago.
Okay, that's great. Thank you, Victoria. So can you share more about that?
I haven't pulled it down and looked at it, but it is for the umbrella agreement people only. So I assume that those tribes that have the 1803 CDC mechanism also can apply for it. And we will be applying for those tribes that do not have that mechanism. So I believe Lemon, possibly Macaw and their Kalispell have that mechanism themselves, so they can look for that board as well. The 1802 also went out, which is funding that NIHB can apply for. So that just went out earlier this morning as well.
Okay, great. Thank you, Victoria, for the update. And that's on the 30 million of the total 80 million of that first appropriation. Thank you.
One more thing. Nick Lewis texted me, and he can't get on the call. I had tried calling in, Terry, and it's not letting anybody in. It's saying it's busy when people try to call in. So I don't know if there's anything we can do about that.
James is on as well. James, is there anything we can do?
So I'm on the line with Jeannie, who's having difficulty trying to get in as well. I'll be troubleshooting on this end so we can keep it rolling. But like I said, we're also recording this so we will be able to share it. So I'll be working on it right now.
Check, check, check.
Our apologies. We had test run this and we thought it was going to go well. Is there any other questions for Laura or the health board?
Ron Allen has a question on the chat box. He asked if we're tracking how many Indians contracted COVID-19 and or died.
Thank you, Chairman Allen, for your question. So yes, we are in the process of collecting that information. We don't have numbers at this point to share, but our epicenter is in the process of collecting that information. And so we will have some numbers to share soon. Any other questions?
Brian, are you on? I think he's on, but I mean, he's dialed in, but he isn't hearing anything. Hang on just one moment.
And Mel, I heard your voice there earlier, Mel Sheldon.
Leonard, this is Chaz. In the chat box, there's 2 comments. Do you want me to read them off? Or
Yes, please.
okay. One comment from M. Hill is our IHS and HHS do not have broadband internet. This keeps our caseworkers from being able to do what they need to do for children and families. That was just a comment. I don't know if somebody wants to reply to that. Ron Allen also asked another question. How do we track IHS is doing getting supplies to our clinics?
Thank you. I think I can answer that last question. And Victoria, I would ask Victoria to jump in if she has any more to add. So we have heard from tribes in terms of, at least for our area, I can't speak for nationwide. We do know that IHS did put out a call for the N95 mask if anyone had an order, and they took orders up until March 17th, and they distributed those. And so I have a list of those tribes, at least, that copied me on those supplies, and I haven't heard from any other tribes after that time. And so to my knowledge, I think most of the tribes in our area did actually request those N95 masks. And Victoria, I don't know if you have any more to add about how we're tracking what supplies IHS is getting out to the tribes.
Well, we are part of the information that we will begin tracking probably tomorrow or the next day from you all is your current supplies. Another thing to mention for Idaho tribes, there is a request on our website, which is www.npaihb.org/COVID-19. For the Idaho tribes, there is a request for ordering supplies from the state of Idaho. And because the case count in Idaho is still relatively low, I would suggest that you get that order in now. I'm sure that Idaho eventually will be running low on supplies as well. And for those of you from other states, I know Oregon supplies to the tribes. I wasn't on the call this morning, so I don't know where that stands at this point in time. But if those of you that are not in our Washington, Oregon, or Idaho region, if you're calling in from another region, you may want to check with your state departments of health to see what they'll be able to mobilize for you, and especially if you have a smaller number of cases right now.
And Victoria is fielding all of our calls on COVID-19, and so she's the main person to contact with your specific questions. So Victoria, and you're always welcome to call me as well, but Victoria, if you want to give your cell phone number, that would be great.
Sure, I just typed it in the chat box too, for those of you who can see that, but my number is area code 503-998-6063. And that is a cell phone, so you can feel free to text me questions as well as call me, whichever will work best for you.
And then briefly, Justin from Lummi said that they purchased a dozen of Verizon hotspots, which they are delivering to people's homes for telemedicine. And then Crystal Hatawi mentioned that she has information or policy information about broadband to share.
Good morning, everyone. So we're working on trying to get some federal funds loosened up from the Universal Service Administration Company. They're the ones that distribute the subsidies for telemedicine, telehealth, schools and libraries, high-cost areas, and low-income customers. We're working on that. We're trying to get them to broadband has not been included on any of the stimuli. So it's important that we start to really advocate for that, because tribal communities are the ones who are suffering the most as far as broadband connectivity. The hotspots is a great idea that is being deployed quickly and to many people. The only thing about that is that when you utilize hotspots, there's the assumption that there's cell phone coverage, and not all tribes have the cell phone coverage that's necessary for those hotspots. So while they're a good stopgap measure, we really, as tribal leaders, need to start advocating for broadband connectivity as well. Both Danae and I are working on letters that can be sent to our congressional representatives, so we can start pushing that.
Okay, any other questions for Laura or the health board? Okay, Brian, you're on now.
Yeah, can you guys hear me? I'm on my phone.
Yes. Yes.
Okay. Oh, okay, great. Yeah, sorry, I had technical difficulties. I can tell you kind of what I know at this point, which is NCAI and the various tribal advocates have been working pretty feverishly over the past few days to get tribal priorities into what is now being numbered as the third stimulus package. The first one was earlier this month, really before the pandemic, before the COVID-19 stuff became a pandemic. The second one was the Families First Coronavirus Response Act. That was signed into law last week, and there were some tribal provisions in there. There was $64 million for IHS, and then a couple of other tribal references throughout. The bill that is in play now appears to be the Senate Republican draft or the Senate majority draft of a third stimulus bill. It's a large bill. There have been multiple drafts that have been circulated up and through this morning, but Part A of the bill is contains various changes or provisions that change programs like regulatory fixes, unemployment fixes, sort of more policy type changes. And Part B of the bill is more of a traditional appropriations bill where it's plussing up, adding money to existing accounts, including for tribes. And so, the big picture is that the bill, the Senate draft, includes some significant new amounts of money for tribal programs in Part B, the appropriation section. I think Laura may have talked about IHS. I think it's slated for just over $1 billion of new money in IHS. I think it's like $453 million for BIA, and some other amounts for BIE. About half of that money, I think, across the board would go out to tribes through tribal shares. So, just through the regular formula distribution. So all that's really good. The one part that tribes weren't really included in, at least as explicitly, was this economic stabilization fund that was really drafted, it looked like, for large companies or publicly traded companies. Tribes are eligible for it, but it's mostly a loan guarantee type of program. And so when the text came out, I think NCAI really wanted to focus its efforts on trying to get some kind of grant component or, in some kind of set-aside amount from that $400 billion economic stabilization fund for Indian country that would be grant-based. And there's just been a lot of activity, across the board, trying to reach out to the committees of jurisdiction and whatnot. So as you probably saw from the news, these negotiations have sort of ebbed and flowed. There were public statements one side accusing the other of different things. But the negotiations continued, and apparently, from all the reports, is that the Senate negotiators are close to an agreement, and the text of the bill is of the final version, is supposed to be released within the next hour or so. We'll see if that holds. So we don't really know yet what's in the Senate bill, but there were efforts to get additional tribal provisions into the Senate bill. Meanwhile, the House of Representatives drafted its own version of a third stimulus bill. And similarly, that went through different drafts. Those were disseminated. And, that the latest text that I've seen of the House bill was from about just after 7 p.m. last night Eastern time. And that bill is similar to the Senate bill, but it has a lot more stuff in it. Most notably, it has a provision that would set aside $10 billion for basically payroll and other types of economic relief assistance to Indian tribes. And the way that's drafted is it would be calculated based on the tribe or the tribal enterprise's payroll losses, and would be used for basically costs associated with the COVID-19 response. So that's something that NCAI and NIGA have really kind of focused their attention on, was to try to get some kind of big dollar pot for tribes that would be essentially an economic relief type of money, which as I read the provision of the House bill, that is. There's a lot of stuff in the House bill. If the Senate reaches agreement on its bill today, the House bill won't be voted on. The House bill will sort of be left hanging out there, but I think it's likely that folks I'm just speculating here, I don't know, but just given how this crisis is evolving, I think it's likely that the House folks would, continue with the provisions in their bill that weren't in the Senate passed bill and keep trying to move them forward. So I guess the big picture is we're waiting to see what happens with the Senate today, what their final version looks like, which should be forthcoming. I think it's fair that if the final draft does get released, and that'll mean that there is an agreement, and I think the House has already indicated that if the Senate negotiators reach agreement, that they'll go ahead and pass the Senate passed bill. But all of that being said, if there's tribal priorities that aren't in this Senate bill, if it materializes today, I think the thought is there's going to be multiple bills going forward to address COVID-19, and that there'll be other opportunities to get those issues addressed. So that's kind of what I know at this point. I'll say this, NCAI, I feel like, has done a really good job in coordinating the different lawyer lobbyist folks. I don't know if there's anybody from NCAI on the call, but in my experience working with them on different work group calls and trying to get stuff pulled together, they've done a really, really good job. So everybody ought to be proud of that. That's all I have, unless folks have questions.
Yeah, Brian's lettered. Thanks for the shout out for NCAI. I'll pass that on to Kevin and Fawn. There was some push to try to get some treaty fishermen aid. I'm not sure if that survived either of the bills.
Yes, so the treaty fisherman provision was in the economic development and employment parity part of what NCAI had put forward. It wasn't in either the Senate version of the bill or the House version. That being said, I think the House version, that economic impact fund, that $10 billion fund, that would definitely leave the door open to having a source of revenue to provide relief to tribal fishermen, is the way I read it. But it's not in the Senate drafts that I've seen. I think if it's not in the final one, which it's probably unlikely to be if it hasn't been in any of the drafts, I think that's something that we'll just need to kind of, put our heads together and keep pushing forward on with other moving vehicles. But I know a lot of time went into drafting that language, so to make it as inclusive as possible. So I think we'll just have to wait to see what comes out today, and then if it's not in there, just keep pushing ahead.
Okay, any other questions for Brian? right. Well, thank you. And moving on, Terry.
There's a follow-up question.
Oh, the follow-up question on the chat.
Yeah. And just so you know, Justin says he has to leave at 9:45. But the follow-up question is, can we get a table with all 3 phases thus far spelled out with dollar amounts and an idea of how much the Portland area will get to disseminate? That was from Stan Phil.
I think this is Brian. I think the table would probably need to come from the IHS and Northwest Regional offices, because they would know based on the share allocation how much they would be getting that would go down to the tribes, and it would obviously be dependent on what the final amounts are. But big picture, the way I read it, both assuming the money in IHS and BIA and BIE is as we believe it to be in the Senate drafts. For the IHS portion, I think it's 45% is supposed to be distributed in accordance with tribal shares. So, I think it'd be up to IHS to figure out what the shares are and how much the area or the region will get, or the area will get, and then how much each tribe will get. So I would say that once there's final action on the bill on the next, IHS and BI calls, I would request, Dean and Brian Mercier to have their staff come up with those numbers. I'm sorry, I wasn't able to hear that.
Can you repeat that?
It's unclear if that was just background noise.
Yeah, probably was.
Okay, any other questions for Brian? Chaz, is there anything else in the chat box?
No, Chairman Allen had a question for Laura earlier, and she typed a response to him. I could read the question and read the response if you'd like.
Sure, the question and the response.
Chairman Allen asked, Laura, do you know the distribution formula for the COVID-19 testing and when it will reach the Northwest? And Laura could reply, or I can just read it.
Go ahead and just read it.
She responds, Chairman Allen, on the IHS call yesterday, IHS talked yesterday about most of the funds going through tribal shares, but there was a lot of talk about getting some of the funds to tribes in hotspots. They said they would send out a DTLL about it with the earliest distribution on Thursday or Friday. And that's all.
Okay. Thank you. Thank you, Brian. We appreciate it. No other questions for Brian? Okay. Is Chairman Solomon from Lummi, are you on the call?
Yes.
Okay. Good morning.
Good morning.
Go ahead.
Okay. Hopefully, Dr. Iwasaki is on, but just an update and kind of what Lummi Nation is working on. March 3rd, Lummi Nation declared a state of public health emergency. And then also, we've been doing what we can to, the best we can to support our public health team. And we've been doing a lot of efforts in addressing COVID-19. Recently, on Sunday night, March 22nd, Lummi Nation did a shelter-in-place order. And so the one thing that we're working on, and we're running into some challenges with the 1135 waiver with for Lummy's mini hospital. And do you know if Justin's on the call?
Yeah, I'm here.
Okay, I'll turn it over to you, Justin.
Okay, thanks. So I'll give a quick overview of what we've been doing here from the public health side, and then specifically talk about our plans to set up an alternate care site, field hospital. So we've tested 103 patients so far within the community, and we've had 8 positive cases. I think we're publishing this on our Facebook page as they come up. That gives us about a 7% positive rate, which actually parallels Washington State right now. Whatcom County, unfortunately, is much higher as of today at a 13 to 14% positive rate. But that is because there is a cluster within a nursing home and a 24 to 30 positive all at once. Could somebody mute their thing? I think statewide, there's a lot of feedback. If everyone can mute. One thing, what the state of Washington,
mute it on which line we can hear. Trying to keep the feedback from coming up.
Thank you. One issue around the country and specifically in Washington State is that there's very likely going to be a shortage of hospital beds throughout the region. And you see that represented by the U.S. Navy or Army sending the Mercy ship to Los Angeles. It was supposed to go to Seattle. You also see evidence of that with Shoreline, which is a city north of Seattle, putting up a 200-bed tent hospital. We anticipate that the hospitals throughout the region are going to be over capacity, and so we decided to set up an alternate care site, field hospital, in one of our gymnasiums. And we've been working on that for the last couple of weeks. I think the guidance, if there's any guidance we could provide about doing that, is understanding what each tribe's capacity is for doing those types of, providing that level of care. For us, we believe we can offer IV antibiotics and IV fluids. I believe we can also offer oxygen, supplemental oxygen to patients, and provide 24/7 physician level care. Obviously, every tribe's going to have to decide what their staffing capacity is and what their physical infrastructure is. But I think it's very rational to start planning for the event that many low acuity patients who present to local hospitals will be either turned away or discharged earlier than they would have in other circumstances. And I'm happy to take questions if anyone has any.
What are the ages of the patients?
It spans all day.
There are no more questions in the chat box yet, but Victoria does post a link to the chat box for more information with the Indian Health Board.
I have a quick question. I know that most of us are going to have to rely on the public health system outside of our own facilities. Suquamish doesn't have a clinic, so we're definitely relying on the public health system. Port Gamble's been supportive, so we've been working with Jeremy and them as well. But I foresee this obviously as a problem or a challenge, or hopefully if we keep the curve down, we'll be able to address this. But I don't know how much people have been thinking about that. Obviously, the health professionals have been thinking about it, but have any quick thoughts on that?
There's modeling, epidemiological modeling out right now that suggests that we are actually too late for mitigation strategies, and it's almost inevitable that the hospitals will be overcrowded. I hope that's not true, but that's what the models say.
And then Victoria says she's going to need to sign off, but Patricia Whitefoot asked, what are the ages of the patients? And Victoria did respond, the majority of the patients are over 40 in the Northwest.
And the Lummi Public Health Department is sharing all of this information as it comes out on our Facebook page under the Lummi Tribal Health Center.
And there's another comment on the chat from L. Anderson. I have been in contact with the VA for beds and masks. They will be getting supplies at the end of this week and said they will check to see what they may be able to share.
Okay, well, thank you, Chairman Solomon and Justin. Okay, Terry, did you have another agenda item for us?
You may have missed that question.
Yeah, I'm sorry, Leonard. Could you repeat that question?
I was thanking Chairman Solomon and Lummi Nation, and then I was just asking Terry to move on to the next agenda item.
I think the next agenda item is Census 2020 update. We have Shana Radford, Elena Kapoman, and Seattle Medmo available for updates.
Okay, proceed with the census.
Good morning, everyone. Thanks for the time. I'm Elena Kapoman. I'm a tribal partnership specialist in Washington State. And hopefully you've all seen that the timelines are being pushed back for operations. One thing that and I think Shane is going to go more into that. Right now, we're really hoping tribal leadership can encourage their citizens to go online. It's really the safest and easiest way to respond to census. And everybody should have gotten their invitations at this point. If they haven't, please reach out to your tribal partnership specialist and we will engage with operations and see what's going on. We're trying to get creative too with how to do outreach. All the events have been canceled. All your liaisons did a lot of work setting up the outreach and engagement activities, but as you know, they've all been canceled at this point. So really it's online engagement, emails, trying to set up like online parties, maybe getting some information into the supply boxes, food boxes to elders, the diaper packs to the babies through Head Start. So hopefully your tribal liaisons, or if there's another contact, we'd appreciate getting that. We know essential staff is only in the offices, but we have a lot of material we can still get out to tribal members. So any help on that front would be greatly appreciated. I know we only have a couple minutes. Shana, do you want to go into your topics?
Yeah, Tatsmewi, Shana Makondo Radford, and Cayuse Nespers, citizen of Umatilla. I'm the Tribal Partnership Specialist for Oregon and Idaho, and I also serve as the Congressional Liaison for Oregon and Idaho. So thanks. Just a couple of updates along with what Elena already shared is we have tribal listening sessions coming up. We can get those to Terry and to James to share. But I did send them out to folks. So those are coming up on April 2nd and April 9th, and that really goes over our disclosure avoidance system and making sure that the respondents' information is kept confidential and how that does look or impact tribes. The other thing was there's a census rumor going around right now about that the census responses are tied to the potential stimulus package. So I just wanted to let people know that that's a rumor, that your answers cannot be used to impact your eligibility for any government benefits, including any potential stimulus package. So I just wanted to get that out there. But in regards to the adjustments, as Elena said, we do have the sheet that's attached, I think that James sent out, pretty much either delaying, extending, or basically moving the dates a couple weeks. We did extend the self-response period or phase from July 31st to April 14th. That's one of the big ones. Our NARFU operation, non-response follow-up operation, shifted longer. Basically, the main things that are still on track are getting the count to the president, and then the redistricting, getting the count to the states April 1st of 2021. And of course, we will remain flexible and adapt as everything is evolving as well. So just in the sake of time, we could leave questions for later, but I wanted to extend a little bit of time to our tribal nonprofit partners to talk a little bit about what they're doing. So I'm gonna hand it over to Siatam Edmo.
Thanks, Shana. This is Siatam, and I'm the Tribal Community Coordinator for We Count Oregon. We Count, as kind of mirroring what the Bureau has done, has ceased all of our activities as of 2 weeks ago, indefinitely. And I just want to underscore and the opportunity that we see for tribes to come together around potentially pushing the report dates out. I know Shana shared that right now some of the dates that are remaining the same on the report that's going to the president, but to avoid politicizing hard to count communities, so of which Indian country is one, right? So right now we're focusing on keeping our community members healthy and safe. But if we keep to the dates that are that we currently have by getting the report to the president by the end of the year and such, I think that our hard to count communities and Indian countries specifically will be severely undercounted. And so I think it's important that we come together and send as tribal communities and send a message right now, if we can, that we need an extension on that reporting to the president. So if that's something folks are interested in, I am interested in coordinating a letter in response, and I'll work with our sister organizations, Na'a Ilahi Fund up in Washington State and Western Native Voice over in Montana to push that out and include tribes in the West. And we're pushing all of our census response online. And I also think it's an opportunity, somebody mentioned on the call earlier about broadband access. We are working with partners at Comcast and other internet providers to amplify signals in rural communities. And I do think, separate from any stimulus packages that are moving through government, those of us who are working in the nonprofit field can help and assist bringing and connecting business who desires to do their work in ways that support and uphold tribal sovereignty, right? Making those connections with Indian country in the West. Really using the census right now and the work that we need to do, that we're for counting all of our folks to amplify and bring more resources toward Indian country in the West as a whole. Thank you. And I'll hand it over to the next agenda item.
And there's and Elena also shared a link on the 2020 census website that allows tribes to see how their tribal response rate is doing relative to the nationwide response rate. And then Shana also shared a link to the 2020 census.
Can I just say one more thing really quick?
Please do.
Thank you. I just wanted to just really emphasize that right now is the time that it's a little bit chaotic, but right now is the time to really send a message about, stay home, stay safe, but you can do your census right now, either online, by the phone, or sending in your mailer. So we really need our partners to kind of get creative and also be sending these messages out while you're sending out other COVID-19 messages. So that'd be great. Thank you.
And if someone lost their mailing form, can they still respond to the census?
Yes, you don't need to have the code that's on your invitation that was delivered to your house. You can just go on the link that Shana posted, the 2020census.gov, and there's a link that says respond now. Just go ahead and do that. That's great. Many tribes are doing like incentives or little contests if you send in your confirmation page. So when you complete your census online, at the very end, you'll get a page that says, thank you for completing the census. Here's your confirmation code. You can save it as a PDF or just as a screenshot. So we're encouraging tribes to do that to get people a little excited, have a little fun with the census, and be able to use some of the funding that's been distributed by groups like Siatam and Na'ilahi.
All right, any questions?
I know Leonard did his census. Did everybody else?
Yeah, I got mine done. It took like 2 minutes. I was just going to say that if you guys could use your social media influencing, I know you're all influencers out there, and get people to get on and do it, that would be awesome. It's really easy. And we got plenty of people to help. And I was going to ask a question about counting. I think some of our people will know people that aren't, maybe are homeless or transitional or whatever in our communities. And is there a plan for for us to provide that information and say, hey, this person probably hasn't filled it out without invading privacy? I don't know how you guys are going to handle that.
They can complete it on cell phones. So if 6 feet away from them, but if they have their own phone, they can go ahead and go onto that same website link. The operation that will do the sweep across the nation to count people experiencing homelessness, maybe they're in a car, maybe they're under bridges, that sort of thing, that has been pushed back. And in Washington State, the operations coordinator is just saying right now everything's on hold, and more information to come as he kind of assesses the situation and make sure that all the enumerators are safe, that the people that are being contacted are safe too. So right now everything's kind of in a holding pattern, but at least push back a month. If you know someone that is experiencing homelessness, they can go online. The last information I heard, and maybe Shana can correct me if she heard something more current, is that like if you have a couch surfer, like my cousin was sleeping on our couch, he should fill out his own form. So my family who normally resides here majority of the time would all be on one, and then the person that's temporarily staying with us would fill out their own form online. There's a little box that says, are you experiencing homelessness, or is this your usual residence? So just kind of follow those directions online.
And then Siatam shared a link with WeCountOregon.com/Native-American-communities. I'm not sure what's in there, but she did share that link. And then Rosina said that she has not yet done her survey, but she will get it done today. And Chairman Allen said he's done it, and so has his kids.
Excellent. So once again, we're recording this this meeting. It will make this video available along with all the links and everything provided on the ATNI website. Thank you, Shana. Thank you, Elena. Thank you, Siatam. I think up next we have education impacts. We'd like to hear from Patsy Whitefoot, the ATNI Education Committee Chair.
Good morning, everyone. Can you hear me? Can you hear me? Okay, yeah. Thank you. Thank you. It's good to hear everyone's voice and to see those that are online. It's a good day today. Just with regard to our children, because I'm currently in a housing project where my son lives. I've just been with them for a while. But with regard to our children, every day I'm able to see them run out to the school bus and be able to pick up their lunch and their breakfast, the meals that they're eligible for. And so while the focus of the paper that was done to Congress was on the BIE schools, this also includes our children that are in public schools as well. So nationwide with 183 schools under the Bureau of Indian Affairs, this is something that continues to move forward. With regard to the BIE schools and the school closures, as we know in all of our states here, the schools have been closed. But what this means for the Bureau of Indian Education schools, they've requested for additional funding for the schools for infrastructure and training. And the amount that they requested was, I think, about a $20 million. And basically that was to get them through the remainder of the school year. Well, actually it was only for 4 weeks of the schooling, and which includes Haskell, Indian Nations University, and the Southwest Indian Polytech Institute in Albuquerque. And when I saw that letter, I thought, I don't think you're going to need more than, well, actually it was for 40 million for the 4 weeks to continue with BIE schooling. So as we know and as we're hearing, this virus is going to be here for a while. And so there's definitely going to need to be an extension for the BIE schools. So what that's going to mean is that the schools are going to need to be extended and then perhaps early start for the next school year. And so that's going to be an issue. And as we heard, it's going to be pushing back the timelines that everyone is operating under. So a big push right now with regard to the BIE schools is providing for federal health benefits for all BIE school employees. While those benefits are provided for the BIE funded schools, the direct BIE schools, it's not necessarily funded for those that are under contracts or grants. And so there's amendment that has been inserted into the Indian Healthcare Improvement Act to allow for accessibility to the lower cost insurance options for employees, which would be a significant savings. So that's with regard to BIE schools at the K-12 level. For the tribal colleges and universities, again, which is funded under the Bureau of Indian Education, as we know, we have 2 colleges here in the Northwest. We have the Northwest Indian College and, of course, Salish Kootenai over in Montana. And so they're requesting for 27 million for the immediate needs and closure. And similar to K-12 schools, is really having to take a look at the school year. When I was talking to the National Indian Education Association, it was reported that all of the schools are going to have to just probably be on closure throughout the school year. So the impact that this is going to have is, of course, for the students. And so having to make certain that our students' needs are being met, and the need to identify the needs of those particular students. While we might have, places like Lummi that is providing or conducting their shelter in place, students sometimes like homeless communities as well experience their education opportunities and their time in schools a little uniquely. Sometimes you might have students that are couch surfing, as you heard previously, and so those are the students that we need to make certain that we're paying attention to, and also that we're helping to support their needs with food, basic supplies, basic bills. If they have internet at home, then that accessibility as well. So that's going to be important for our particularly our college students, and as well as our high school students, for those that have accessibility to internet. And throughout the letter, there is, of course, the issue of just accessibility to internet, non-accessibility to E-rate for students and communities. And so that results in, the development of courses for students online, the need for appropriate equipment for our schools, but also for our students and their families. And of course, this is going to impact career technical classes as well. So just to be able to say that, well, we could possibly go to online schooling, that's not necessarily true for Indian country. And I think with this emergent need that we have, it's just showing us about those significant needs that we have in Indian country. Two other items that I want to address that the Bureau of Indian Education has highlighted is the need for funding out of the National Emergency Student Financial Aid, which is going to be supporting students in response to COVID-19. There are two bills in place that are focusing on that, and the Department of Ed is looking at $1.2 billion. The tribal colleges and university are requesting $40 million from that. And so that's something we'll need to help advocate for, particularly for Northwest Indian College, well, for all of the tribal colleges throughout the United States. And of course, through ATNI, we've been able to do that with our colleges. The final one is the post-secondary education institution funds that the Department of Education is also going to be seeking. That amount is $1.5 billion, and the tribal colleges and universities are requesting $46 million for infrastructure and the training needs of our communities. And so that's very brief, focusing on the Bureau of Indian Education schools, but I do just want to say here in the state of Washington that our Washington Education Association has a survey that's gone out to take a look at some of the educational gaps that exist, particularly in Indian country, in our rural isolated communities. Of course, I'm from White Swan, and it's very rural. And when people start talking about, having online courses, and I'm thinking many of our families in White Swan don't necessarily have internet access at home, and let alone when you're in rural communities, and you also don't always have access to food as well, or just some of the basic needs. And so there's a challenge, particularly for our rural communities and reservation communities. So thank you. Be willing to take any questions, or just feel free to email me later.
Thank you, Patsy. I think we should probably hold the questions, and we'll make sure Patsy's contact information is available. Just as we are already kind of running near time here. I'd like to have Amber Schulz-Oliver from the ATNI Economic Development Corporation provide an update on economic impacts.
Thanks, James, and thanks for the invitation to be on this call. We at ATNI EDC have really been focusing more on the impacts to small businesses. But I was just sent a letter from NCAI, Native CDFI Network, NCAIED, NACA, and NAFOA. And so I'm just going to step through what the national ask has been around economic development and employment. So the letter outlines 4 immediate economic stabilization priorities. The first is to provide at least $20 billion allocated for direct federal relief grants to tribal governments and their enterprises in the form of a Tribal Fiscal Stabilization Fund under the U.S. Department of Treasury. The second priority is to provide at least $2 billion for a tribal forbearance, loan, and guarantee fund allocated for assistance to tribal governments and their enterprises to replace lost revenue. Specifically, they're asking to provide $2 billion to a tribal loan guarantee fund to address credit emergencies, and to provide tribal governments and enterprises temporary forbearance. The third priority is to provide not less than $110 million in additional funding and waive restrictions on small business administration and treasury programs for Native American contractors and the Native Community Development Financial Institutions to provide for emergency funds and waiver of program restrictions. Specifically for the Native American contractors, they'd like to allow tribal access to the SBA 7 loan program to ensure that Native American contractors and participants in the SBA Small Disadvantaged Business Program can access COVID-19 contracting opportunities. the provisions of the 2020 National Defense, what is that? National Defense Authorization Act, raising the cap on the sole source contracts should be applied to all federal agencies, and exempt from the SBA from category management. And Native American contractors should be included in relief provided to federal employees. For Native CDFIs, they ask that, that no less than 100 million be allocated to the Native American CDFI Assistance Fund, and to extend matching requirement waiver for Native CDFIs receiving Native American CDFI Assistant Awards. The final priority is to provide parity to ensure individual and employer emergency assistance is accessible to tribal governments and their enterprises and employees, ensuring inclusion of Indian tribes and tax credit for employers, addressing unemployment insurance reimbursement disparities, protecting tribal fisheries, and the suspension of 401k loan payments, extension of time period prior to 401k default, and relaxed hardship distributions. So like I say, I wasn't involved with any of those conversations, and as Brian Gunn reported earlier, there's already a lot of this language that's drafted. What I've heard is that these specific asks are not outlined in any of the bills, but as Brian also said, there'll be other opportunities in other bills to be able to push these priorities.
Okay. Well, I don't think we have any questions at this time. And I think we have one last agenda item, was just hearing from the membership who's available and on the call in terms of anything that they see as unique best practices that they'd like to share. If they're not on the call, once again, I think what we're going to do is create a section on the ATNI website that can be a repository for a lot of this information, so it can be shared out as well.
All right, any last comments before we sign off? I know everybody's pretty busy. It seems like you'd be less busy working at home, but it hasn't been working that way for me. But I just want to thank everybody for weighing in. And I was just thinking this morning that our generations before us have been through really tough times. You think about, way back with the first epidemics hit, and then, the boarding schools and World War II, and it's even the civil rights era, Vietnam era. There's been a lot of tough times people and our elders have persevered through. So there's a lot of things to be concerned about, but we have a lot of resilience too. So let's rely upon that and our creativity here in the Northwest. We'll let you know if we need to do any outreach to Congress. I know you can do some individual things, but most of it's just happening so fast that I don't know if additional pressure will need to be placed or encouragement. But it's important that we stay in contact with that, especially with that scenario that Brian had about there being future legislation is going to continue. So they're getting emergency legislation out more, but I think there'll be more coming. So with that, is there anybody else had anything last comments before we sign off?
Yeah, well, President Forsman, we had a comment from Chairman Allen. How often does ATNI plan on these updates? And so I believe it's Terry's intent to have this weekly at the same time, through the same process. So that's something that we'll make sure it gets shared out. Yeah,
we'll probably start out weekly. We might expand out as time goes on, but definitely within the next 10 days.
Excellent.
Okay.
All right. Thank you. Thank you to everybody for joining us.
All righty.
Thank you for hosting.
You're welcome.